Not so long ago, we brought you the untold positive story of Somalia's capital city, Mogadishu. A story of resilience under the banner Mogadishu Today. We are back in the city, this time not to talk about business, but Somalia's health sector.
The lowest moment is especially when you don't have funding or supplies for the next year.
Rebuilding Somalia's broken health sector. Just what will it take?
I would want to come back to the emergency cash transfer system that we set up, and that is a part of that would be a safety net.
Welcome, I'm Alex Chamwada, and on standby to bring us that report is my colleague Elijah Mwangi. But first, here is our fact sheet.
According to the United Nations estimates, the population of Somalia is about 15 million. Healthcare in Somalia is largely in the private sector. It is regulated by the Ministry of Health of the federal government of Somalia. According to the World Health Organization, health expenditure in Somalia remains very low, and there is a critical shortage of health workers. There are nearly 5.4 million people in need of humanitarian assistance in Somalia, including more than 2.2 million who need immediate food aid. Malnutrition remains high across the country. According to the European Civil Protection and Humanitarian Aid Operations, there are around 2,000 sites in Somalia for internally displaced people, and on average, 26,000 displaced people are evicted every month from makeshift shelters, especially in urban areas. The under 5 and maternal mortality rates in Somalia are amongst the highest in the world.
Rebuilding Somalia's broken health sector. That is the focus of our show today. We now join Elijah Mwangi for the full report.
Insecurity problem in Somalia can be traced back in 1991 after the collapse of the Siad Barre's government and the subsequent civil war. Recurrent civil conflict has blocked progress toward improving health in Somalia. Despite Somalia's security threats and the difficulties in managing the political obstacles to its reform agenda, the Horn of Africa country remains on a positive trajectory. This is Mogadishu, Somalia's capital, a city that inspires hope as much as it evokes despair and desolation. For many years, it has been termed as a war-torn city, but comparing the current situation with how it was in the late 1990s, let's call it a city on the mend. Abdirahman Omar is the mayor of Mogadishu and the governor of Banadi County. He paints a picture of the current security situation in Mogadishu.
Everywhere you go to nowadays, terrorists target and attack. So if we compare about Mogadishu, what it used to be, and now, I can confidently say now it's even safer. The only issue is the terrorist attack, and that's why we are here, confronting, fighting, and eliminating the threat posed by terrorists.
From insecurity to another issue which is connected to the provision of healthcare in Somalia.
We have over 500,000 internal displaced people that fled from other regions due to the conflict. And so all those are the challenges that we are trying to change them to opportunities. We are focusing on finding a durable solution to the internal displaced people because we see them as a great economic benefit to the city. We want them to fully integrate into society.
There is a high risk of diseases outbreaks due to crowded settlements, and the most affected areas include settlements for displaced people in Mogadishu. As the country struggles with the internally displaced people, there is another problem that is calling for attention: repatriation of Somali refugees.
I mean, one of the things that we always talk about with the Somalia situation is it's not enough even for donors and for people to fund the repatriation process. There also has to be, a funding for development inside Somalia. Or after years and sometimes decades, you're looking at places that have no schooling, that have no basic infrastructure, that don't have basic health care, where the security sector is still being reformed. And oftentimes those things are big, those things are key to ensuring that home is a place that refugees feel they can go back to and rebuild their lives.
Well, it's in no doubt that it all goes to rebuilding Somalia, and European civil protection and humanitarian aid operations, commonly referred to as ECHO, has come in handy to rebuild the healthcare sector in Somalia.
Well, ECHO in Somalia is covering many grounds and many sectors. I think there is many basic needs in the health sector, in the nutritional sector, food security, but also water is always lacking. And so for the health sector, we really count on the SOS in Somalia, which has always been there despite all the difficult circumstances. I remember the first time I visited SOS hospital in Mogadishu was in 2001. That's the time I go back. SOS hospital in Mogadishu has always been an anchorage, so primary and secondary health care for many people of Mogadishu.
Would you be in a position to tell us, the level of funding of some of these projects?
I think in ECHO is for humanitarian aid in Somalia varies between 50 million euro, that's about 55 million US dollar, and in periods where the drought is hitting more and where we have more acute needs to fill, that can go beyond 100 million. So, for example, in 2017, we had 120 million euro, which is about $130 million to help the people in Somalia.
And talking of funding, perhaps maybe in a nutshell, you can talk of the key milestones that you can cite as far as your mission in Somalia is concerned.
We really try to expand as a type of activity is the cash transfers, and that is in the context of the emergency is the emergency cash transfers, which are actually small sums of money that people receive, those that need it the most. For example, when they are displaced, they get a small amount of money to survive during the difficult period and to try to recover from the immediate shock of the displacement and the immediate shock of the drought and the needs that are increased because of the drought.
You've been to Somalia. You cited 2001 when you were in Mogadishu. So you are so familiar with Somalia, so to speak. What will it take to rebuild Somalia healthcare system?
We have to work on the basic services that have to be improved, including the health sector. There is an under coverage of health services right now in many parts of Somalia. There is support needed to the people to cope with these acute periods of increased needs. So that it requires a lot of policy work and organizational work on the side of the government, and it requires also reaching out to the donors who look also in the long term, so as we call it, the development donors. It is not only the humanitarian actors that can solve it. We need to look at the longer term help from the development donors. Well, I think the first challenge remains always the security, which is remaining a very serious problem in parts of Somalia, which is leading to sometimes difficulties in access from the different partners, the government and external partners, to access the people in need. So there is, the access can be because of insecurity, but also logistic problems that can be faced. And so that means that actually part of the population of Somalia has needs that are not always covered sufficiently.
As we wrap up this conversation, when you look at what's happening in Somalia, what you are doing in Somalia, is there anything specific that you feel perhaps other development partners can take up in Somalia to help rebuild Somalia?
In fact, what is this? This is the emergency and immediate response to something broader that could exist one day in Somalia, and that is a part of that would be a safety net for the people who are most vulnerable and who need it the most. So a safety net to be set up, which would go further, not only in the emergency phase, but further into the longer term programming of different sectors.
Thank you, Elijah. And on that note, we take a short break. Still to come.
Alhamdulillah, da'di lawada liqamili ligu sameeyo.
Welcome back. Today we are discussing rebuilding Somalia's health sector. Now, according to World Health Organization, health indicators in Somalia are among the lowest in the world. But what is the role of stakeholders? Elijah Mwangi visited the SOS Mother and Child Hospital in Mogadishu, and this is what he found.
A few kilometers away from the central business district in Mogadishu lies a story of hope. A story beyond Somalia's dangerous label, forget ruins and rubble. In most cases of prolonged conflict in a country, women and children suffer the most. And that's why here in Mogadishu, Somalia, one cannot downplay the establishment of such hospitals, SOS Mother and Child. It is a facility implementing health and nutrition program that engages in life-saving measures to prevent excess morbidity and mortality in Somalia.
SOS established a base in Somalia in 1982 when the organization signed an agreement with the government of the day. And this health facility was established a little later in 1986. So it started as a small dispensary then, but when the conflict started in 1991, this place was converted into a big hospital. Some of the sections, like the children's wards and what have you, are primary school classrooms. It has 124 bed capacity, 48 in the maternity section and 76 in pediatric section. We have outpatient services, we have inpatient services, we have maternity, we have pediatric wards, and then MCH, where we provide antenatal care, postnatal care, immunization and all that. Then we also have an operation theater that provides what we call CIMOC, that is comprehensive emergency obstetric care.
Bear in mind that Somalia is among top countries in the world that have high rates of child and maternal mortality, as mothers have limited or no access to skilled medical care. Mohamed Dakane, the medical director at the hospital, attends to Halima Dahir. She's one of the mothers here who had to go through cesarean delivery at the hospital.
Alhamdulillah, da'di lawada liqamili ligu sameeyo. Qalin ligu sameeyo. Titar mas'id titarka ligu sameeyo. Marka masha Allah wax badan ka faa'iiday. Alhamdulillah, adeegyo badan faa'iido iga soo gaaray. Maxaa ka mid ah in dad fiican joogaan ay soo dhaweeyeen. Maxaa la dhaqaatiirta kalkaalisooyinka masha Allah kulli fiican yihiin. Dad fiican ay dayeen masha Allah. Si fiican dadku u gargaaro. Caawiyo. Marka maxaa ani cunugeyga la ilaaliyo markasta masha Allah. Alhamdulillah. Dadweynaha waxay sheegayaan inay ka faa'iideystaan imaadaan isbitaalkan masha Allah.
Halima's story is shared by many mothers who have benefited immensely from the facility. Getting such maternal services for free in a public hospital is a great relief for them, because healthcare in Somalia is largely in the private sector, which, as you would expect, comes with a high cost.
qaybaha waxa uu kala qaybsamaan qayb antenatal care qayb la dhahayo oo ku maxaa la yiraahdaa bukaanada sida maxaa la yiraahdaa kiisaska eclampsiyada sida maxaa la yiraahdaa kiisaska anemic kiisaska oo dhiig baxa qaybka deliveryga ahaa jirto oo waxay ka mid tahay maamooyinka oo umulaya ama foosha hayso oo lagu caawiyo qaybta oo waxaa jirto OPD la dhahayo oo waxaa ka mid maxaa la yiraahdaa bukaanada socdo in lagu daaweeyo kiisaska emergency-ga qaybta postnatal hadda ku jirno waxaa ka mid qayska hooyooyinka oo qaliimada lagu sameeyo hooyooyinka dhalo oo lagu keer gareeyo shantaas qayb iyo qaybta oo OT department ahaa jirtidana oo kiiska lagu qalo kiiska emergency iyo qaliimada u baahan oo u sameynaa jirto.
In a different ward for normal childbirth delivery, Zahra Mahmoud is recuperating after a very painful experience during childbirth outside the hospital. She almost lost her life, but thanks to SOS Mother and Child, she was rescued and she's now out of danger.
ما شاء الله وكان اللي دي وشو هراها حنا معدرك هراها حنا يما حارنا اللي قوادي
إليكم مدن هذا شغالة ونكسن إلها إلى كل مية حري وإليكم مدن ما بعرف الحري إيش شري ولي ما بعرف شغال ساس وشغال هي سواء إدنى ولي ما أعرف ديك واكنا إليكم مدن هذا أول فضينا إليكم مدن هذا شقور أن إليكم مدن هذا الله يفدي وقال ما هي نحبنا من حساكي لا أي تري وقال كان هذا هايا.
Another busy section of the hospital, Pediatric Unit. This section specializes in the care of critically ill infants, and just like any other day, you'll find long queues here. This facility has got a lot of support from the European Commission Humanitarian Aid and Civil Protection Department, and those visiting the facility can now access a wide range of services related to safe motherhood.
waxaan leenahay dhowr qaybood oo kala duwan qaybta bukaan socod eegtada oo maalintii lagu daaweeyo 150 ilaa 200 oo bukaan waxay qabtaan ilmaha ka xanuunsan neef mareenka guud ahaan sida mataqaana dhagaha ilmaha ka jiran kuwa neef mareenka kale ka jiran sida sanbabaha kale ilmaha shubanka qabo nafaqa darrada dhiig la'aanta waxaas oo dhan waa lagu qaabilaa sidoo kale waxaan leenahay qaybtan oo la yiraahdo emergency department waxaa lagu qaabilaa xaaladaha aadka u daran gaar ahaan ilmaha qabo respiratory infectionka oo qaybta sanbabaha hoose ku dhaco la yiraahdo pneumonia ilmaha qabo malnutritionka nuuciisa aadka u daran oo la yiraahdo severe acute malnutrition ilmaha jadeecada qabo kuwa qabo xanuunka la yiraahdo meningitis oo maskaxda ku dhaca kuwa qabo shubanka xaaladaha kala duwan oo ilmaha bisha ka yar soo wajaha.
Those still in operation and delivering key services to women and children in Mogadishu, the Pediatric Unit struggles with a myriad of challenges.
waxaan leenahay dhowr qaybood oo kala duwan qaybta bukaan socod eegtada oo maalintii lagu daaweeyo 150 ilaa 200 oo bukaan waxay qabtaan ilmaha ka xanuunsan neef mareenka guud ahaan sida mataqaana dhagaha ilmaha ka jiran kuwa neef mareenka kale ka jiran sida sanbabaha kale ilmaha shubanka qabo nafaqa darrada dhiig la'aanta waxaas oo dhan waa lagu qaabilaa sidoo kale waxaan leenahay qaybtan oo la yiraahdo emergency department waxaa lagu qaabilaa xaaladaha aadka u daran gaar ahaan ilmaha qabo respiratory infectionka oo qaybta sanbabaha hoose ku dhaco la yiraahdo pneumonia ilmaha qabo malnutritionka nuuciisa aadka u daran oo la yiraahdo severe acute malnutrition ilmaha jadeecada qabo kuwa qabo xanuunka la yiraahdo meningitis oo maskaxda ku dhaca kuwa qabo shubanka xaaladaha kala duwan oo ilmaha bisha ka yar soo wajaha.
The lowest moments is especially when the year is ended and you don't have funding or supplies for the next year. Almost everything is running out of control. There is a shortage of supplies here and there everywhere. That is usually the most stressing moment.
It's no doubt that the facility requires more funding for it to have the capacity to handle the ever-surging number of patients. From the pediatric section to maternal and child health clinic, commonly referred to as MCH. The clinic provides antenatal care to women, ensuring that they have a healthy pregnancy and birth. Postnatal health is also provided at the newborn unit of the Mother and Child Clinic. While at the Maternal and Child Health Clinic, mothers are also advised on key components of motherhood, such as the importance of breastfeeding and nutrition. According to UNICEF data in this region, feeding practices relating to breastfeeding, including breastfeeding within the first hour of the infant's life, exclusive breastfeeding for the first 6 months, and continued breastfeeding for up to 2 years, are extremely poor, at 23% for the first hour, 5.3% for the 6 months, and 26.8% for up to 2 years. But with the maternal and child health awareness being created here, these numbers are deemed to change. Perhaps just a matter of time.
maalinta habeenkii u dhashay ilaa xeeday ilaa sanadii 4 bil inta gaar naasku nuugay boqolkiiba boqol waa ka caafimaad badnay halkii oo la soo labeeyay anoo jiran halkii dambe oo saddexaad dhalay oo kan iga horeeyay caana la siiyay waan kii horena caafimaad badnaa
wax badan ka faa'iido sida talaalka uudinta ilmaha markii oo naasnuujinta breastfeedingka immunizationka ma baa ka faa'iidna benefitska wax badan ka helnay talaalka sida hooyada markii oo kujisada maxaa la tetanada oo la siinayaa ilmahan difaaci u tahay hooyadan difaaci u tahay breastfeedingka wax badan ka faa'iidnay in cunuga 6 bilood markuu jiro caana bas la siinayo oo immune systemkiisa uu ku jiro naaska hooyada oo wax kale loogu darin markuu 6 bilood aafana cunto loogu daraayo macnaha complementary oo loogu daraayo si uu xoojiyo immune systemka cunuga kuwii hore to qaar waa siin jiray qaarna ma siin jiray laakiin markii si fiican igu sharxay isbitaalkan imaaday wax badan ka faa'iiday waxa uu sheegayaa inuu talaalka fiican yahay breastfeeding uu fiican yahay sida cunugeedii hore soo ahaan jiray iyo kan soo ahaan isku barbar dhigto cudurrada ka difaaci kara ilaahay ku soo talaalka intaas loo sheegaa.
Expansion of new facilities at SOS Mother and Child Hospital is underway, but for this complex to stand the test of time, adequate funding is critical. Otherwise, the dream to have a health care that befits the people of Somalia might remain to be just that, a dream.